Hello, this is Dr. Donald John Babu. I'm a surgical oncologist at Reliance Hospital, Navi Mumbai. Today, we'll be speaking about the urological tumors, mainly the kidney tumors and the bladder tumor. So, I will keep the first part to explain about the kidney tumors, and the second part will be about the urinary bladder tumors. I will keep the penile tumors and the tumors related to the prostate for another session. So this session I will dedicate to the kidney tumors. Now, what are kidney cancers or the kidney tumors? It is said that any swelling arising from the kidney when seen from a sonography or a CT scan, unless proven otherwise, will be a kidney cancer. Now, kidney cancers biologically are uniquely different from the other tumors. For example, kidney tumors do not respond to chemotherapy or radiation. Kidney tumors are tumors arising generally related to the immune system of the body. Modulating the immune system could decrease the size of the kidney tumor. It is also believed that removing the primary tumor of the kidney when the tumor has already spread, which is a stage 4 kidney tumor, can help in mitigating the growth of the tumors that have spread to the other parts of the body, which is contrary to the biology of other tumors. In other tumors, removing the mother cancer can actually increase the growth of its metastatic tumor cells. But in kidney tumors, it is the opposite. So biologically, kidney tumors are very different. Now, kidney tumors, where do they arise from? Kidney has 2 or 3 parts. One is the cortex. Now, cortex is the place where the urine is formed. Second is the medulla. The medulla is the inner part of the kidney, and that's where the urine is collected. And the third part is the calyx. Now, the calyx is the vessel where all the kidney that has been concentrated and collected goes into the calyx, which is basically a funnel. This calyx then drains into the ureter, which is the pipe connecting the kidney to the urinary bladder. Now, most tumors arise from the cells of the cortex or the medulla. These are primarily called the renal cell carcinomas. Tumors arising from the calyx or the ureter is generally a different biology. They are called as the transitional cell carcinomas. Now, renal cell carcinomas can have different subtypes. For example, the clear cell carcinoma, chromophobe cell carcinoma, and so on and so forth. They are just subtypes of the cancer of the renal cell carcinomas, which are basically adenocarcinomas. So renal cell carcinomas, also called the renal adenocarcinomas, are tumors arising from the glands of the kidney, hence called as adenocarcinomas. Now, what are the causes of kidney tumors? Kidney tumors are basically seen in people who smoke a lot, chronic smokers. Second cause is kidney tumors are associated with hypertension. Kidney tumors are associated with diabetes. Kidney tumors are associated with obesity. So, there is no direct causation to hypertension, smoking, or obesity, but These three factors are generally seen or associated with kidney tumors. One of the most primary causes that we have seen is certainly smoking. There are other rare causes of kidney cancers like genetics. There are very rare syndromes like the Birt-Hogg-Dubé syndrome, hereditary renal papillary carcinomas, von Hippel-Lindau syndromes. These are the hereditary tumors that may give rise to kidney adenocarcinomas. Kidney cancers are also seen in a very young population, which is anything between 2 and 5-year-old children, but they have a completely different biology. They are embryological tumors, they are treated differently, and that won't be discussed in this session. We are discussing primarily the kidney tumors that arise at a certain age, which is above the age of 50, and these are the kidney adenocarcinomas or the renal cell cancers. Now, how does one detect these cancers? Kidney cancers are generally detected when one has blood in the urine, some pain in the flanks. When I say flanks, these are the sides of the abdomen or the back side, where a person generally points to some pain, or it could be just a routine sonography when you detect a kidney cancer. When a sonography detects a tumor in the kidney, one undergoes a CT scan or sometimes even a PET scan. Like I said, kidney tumors are very unique. Any tumor arising from the kidney is generally assumed to be carcinomas. Benign tumors arising from the kidney are very rare. So we do not biopsy, or we never put in a needle to conclude the diagnosis. A CT scan or a sonography is sufficient to conclude that this is a carcinoma. However, there are also cysts arising from kidneys. Cysts are fluid-filled bags. They are generally seen at an older age. Sometimes you have cysts arising from kidney. Cysts are classified on sonography and kidney as cyst type 1, type 2, type 3, type 4. This is called the Bosniak classification. I would say Bosniak classification 2N, 3, 4 would be classified as a complex cyst, which means it has a possibility of cancer and hence should be operated or treated. Now, we have seen the symptoms arising from kidney cancer. How do we investigate, which is nothing but a CT scan or a PET scan. And now we come down to treatment. Kidney tumors, especially when they are small. When I say small, it means tumors that are less than 7 centimeters, arising from the poles of the kidney, or if they are peripherally located. We can remove the tumor by saving the kidney. This is called as partial nephrectomy, where we remove a part of the kidney but the rest of the kidney is saved. It is slightly technically challenging. We use frozen ice, some few vascular clamps, and then we stitch the kidney. So partial nephrectomy or saving the kidney is certainly possible if it is situated, that is in some way technically feasible to save the kidney. If big tumors are located centrally where they involve most of the kidney, partial nephrectomy is not a possibility. If the tumors are more than 8 or 10 centimeters, it is advisable to go for an entire nephrectomy, also to address the lymph nodes that are around the tumor. Now, what happens if it is stage 4? Tumors that have already spread beyond the location of the kidney. There is a certain criteria where they say that debulking 75% of the tumor is possible. We should go for a cytoreductive surgery, which is basically removing the entire kidney along with whatever lymph nodes you can remove, and then later subjecting the patient to certain tablets, which is nothing but targeted therapy. I've mentioned it before that there is kidney tumors are unique. They are immune modulated tumors. Chemotherapy, radiation doesn't work. However, we have certain tablets that target the growth factors released by the tumor, which helps in the growth of the metastatic cells. Thereby, using these tablets, we can control the growth of the metastatic tumors. Kidney tumors also have a propensity to spread to the bone. If they spread to the bone, we also address them with radiation. This would conclude my session on kidney tumors. To summarize, primarily these are the adenocarcinomas of the kidney arising from the glands. Smoking, obesity, hypertension, diabetes are associated and causative factors of the kidney tumors. Kidney tumors have blood in urine, swellings, pain, which are symptoms. They are investigated by a sonography, CT scan and a PET scan. No biopsies are done. Surgery is the primary treatment for kidney tumors. Stage 4 are also treated with surgery and tablets. When it comes to surgery, partial nephrectomy is certainly possible. A radical nephrectomy is done for the bigger tumors. These tumors can be addressed with an open surgery, laparoscopy and robotic surgery. There is a second variety of tumors, which are the transitional cell carcinomas, like I've mentioned before. Those tumors I will address in the next session with the bladder tumors, because the biology is similar. Thank you.